So we have lots of data, lots of changes always coming our way every day as far as COVID-19. So always great to catch up with Upstate University Hospital infectious disease specialist, Dr. Stephen Thomas. Dr. Thomas, thank you so much for joining us again tonight. Appreciate it.
Hi, good evening. How are you?
Good. So Dr. Thomas, let's start with this. The state announced, the governor last week, that on April 28th, that hospitals, medical facilities would be able to start doing elective outpatient surgeries and treatments April 28th. That's tomorrow. So is that going to happen? Is Upstate ready with that?
So you'll have to define ready. So we've been planning for this for a little while. We've always assumed that it's going to be much more complex to open it up than it was to close. And there are a number of things that we have to consider. So the first thing we need to do is, of course, look at the list of surgeries and procedures that had to be delayed, and we have to choose the ones that really need to be done sooner rather than later. The other thing we have to do is to make sure that while there's still COVID being transmitted within the community, that we are able to bring these folks into the hospital and able to bring the staff into the hospital so they can do these procedures and do these surgeries under the safest conditions possible. And so that means, of course, ensuring that there's enough PPE. That means having a screening process in place to make sure that the people who are coming in from the community are not actively ill at the time of the surgery or the procedure needs to be done. So we're still in that planning phase, and we'll certainly let you know before we're actually starting these procedures again.
Yeah, as the governor said, county executive, it doesn't turn on as fast as it turned off. So back to the governor. He talked today about the state's random antibody testing. About 7,500 people, I think he said, randomly tested around the state. What are you making of the data we're seeing both statewide, downstate versus upstate here in central New York?
So I think that it corresponds to what we've been talking about over the last couple of weeks about this sort of iceberg effect, where the majority of infections that are occurring are probably below the waterline, meaning people who get infected and don't get sick, or people who get infected and get mildly ill, so mildly ill that they don't even come to the doctor to be tested. And so the percentages that you're seeing in the governor's data, I think it reflects what we probably expected from understanding the people who are getting ill. So in the places where there are lots and lots of infections and lots of people in the hospital, those percentages are going to be higher. And then in areas like central New York, where the burden of disease was less than downstate, those numbers are lower. And I think our number was about 1.3% based upon the governor's data.
Now, the Onondaga County Health Commissioner, Dr. Gupta, talked about antibody testing at their briefing this afternoon, basically saying that just like testing for coronavirus, that you can't just go out or shouldn't necessarily just go out and get it. What's your thoughts about antibody testing? It's available in some places to anybody. Should you be running out to get an antibody test? And what does that even tell you or tell us?
Right. So, the information around antibody tests is it's nuanced, right? Because this is the first generation of these tests, and we still don't understand what the results may or may not mean. So I think what we're confident in saying right now is if you have a test and if that test is positive, there's a very high likelihood that you were exposed, meaning infected, at some point with SARS-CoV-2. But we don't really know that much more other than that. So for example, if you were tested and you tested positive, you may ask me, does this mean I'm protected from future infection or from future disease? And right now the answer to that question is we don't know. And the World Health Organization came online this weekend, and that was very much their message as well. So I think the best strategy for being tested is to go to your primary care doctor, or the doctor that you or the healthcare provider that you identify as your primary healthcare provider, and to have a discussion with them and to ask them, should you be tested? Ask them why they think you should be tested, and then have the conversation of what that information will or will not be for your particular scenario. Right now, the way that we're looking at it, this is not going to be a drive-through sort of scenario. This is going to be something that you really have to engage with your medical provider.
Quickly, your take on the latest numbers, at least Onondaga County anyway, new hospitalizations, new cases, total cases. What's your read on those?
Yeah, so we continue to have anywhere from 20 to 30 new cases a day. We continue to have people in the hospital with proven COVID, and people that we have suspicion that they may have a COVID infection, and so we're testing them. I think the general trends, if you look over time, the percent of new infections is gradually going down. I think that is primarily a reflection of the job the community has been doing in terms of physical distancing. I think it's also a reflection of the job that the Department of Health has been doing, in the sense that, because we've been fortunate to have access to testing through multiple different routes, the Department of Health is able to track these folks down who have positive tests, and do the contact tracing that's necessary, and do the isolation and quarantining that's necessary. So there's some good news in there, but there's also, I'm cautiously optimistic, because we continue to have patients in the hospital, and we continue to have new infections every day.
They told me to wrap quick, but I just want to get a very quick thought on the fact that we're now seeing the third group of nurses from Upstate University Hospital going down to Stony Brook. You've got to be proud at what you've seen, the way your folks have responded to the need downstate.
And these people are absolutely incredible. The call went out once for volunteers, and multiple people have raised their hand. People are staying longer than they need to. We have people physicians and nurses going to the Javits Center. I think it is an incredible reflection, not only of upstate, but of the central New York region, and how people approach big problems like this pandemic.
Dr. Thomas, we always appreciate your time. Thank you so much.
Thank you.